Thanks for staying with us. So choosing a health plan is sometimes akin to finding a life partner because you have to find the one that's tailored to you, that fits you. Some people will look out for cheap ones. Some people look for the guys that can actually provide, you know, like a woman that can support them. Same way how you find a good healthcare system that works for you, your family, and your loved ones. So joining us to help us understand this better is the Managing Director of Bastion HMO, Naomi Aduku. Welcome to the show, madam.
Thank you very much, and thank you for having me. I'm happy to be here.
So we know people know about HMOs, but many just rather go for the cheapest one in the market because they can't think of giving out money that they earn to you, that they're not even sure if they're going to need their services. Tell us a bit about Bastion HMO and why you should be a choice for us to pick.
All right, so Bastion HMO is a health maintenance organization, and what we are here to do is to provide accessible and affordable health care. Health insurance, as we all know, is a form of financial protection. I say it all the time. Every Nigerian is just one step away from a financial catastrophe brought upon by, you know, some kind of ailment or the other. Why do you have to pay out of pocket? Why not choose a health insurance company that can help with those kind of expenses once you've paid a premium? So that's really, you know, why we're here, to push that agenda, to create awareness about health insurance for all Nigerians. And, you know, given the recent bill that was passed into law, it's important that everyone has a health insurance plan. So I'm here to speak a bit more about that and, you know, just let people know why Bastion Health.
Okay, so, you know, like we keep putting out the word insurance. So can you break down what's this, or how insurance works to a layman that might not understand how insurance works and why they don't have to pay out of pocket? What is a premium? You know, how does it work? Can you break it down for them?
Sure. So you want cover. You want to be able to go to the hospital at any time. I mean, ailments don't tell you when, you know, they're going to happen. So what you do is you look for a partner like Bastion Health and say, I want something that covers me in terms of, you know, if I have any ailment, how can I do this? So what a premium is you now say, okay, we have all these kinds of plans based on this amount and this cover. You can choose whichever plan is suitable to you. And then you pay a certain sum of money. It could be a plan for 30,000, 40,000. It depends, really. And then when you pay that, it covers you, the plan covers you for an entire year. So every time you have to visit the hospital, a partner hospital with the HMO, you can go and say, I am an enrollee of Bastion Health. And what happens is, you know, they attend to you, and we then reimburse them later on for that service that they've rendered to you. So that's really how it is. Okay. But know that you're paying a sum that honestly you wouldn't have paid if you went there to pay out of pocket. Right. So it's much more affordable, and it protects you at the point in need, because sometimes you're out of pocket, that's the truth. But if you fall ill and you do have to go to hospital and you do have a cover, you know, instantly the hospitals attend to you. So that's how it works.
Yeah, so for someone who's thinking, I have options, a lot of HMOs are coming to my company, they want us to pick, and I do not know which one to go for. What are some of the criteria they look out for in choosing an HMO? That's one. And what stands you out as one of the HMOs amongst many other HMOs?
Okay, so very good question, because this is always the problem. There's so many, you know, options to choose from. But first off, you must evaluate your own current health status. Okay. What are my ailments, for instance? Am I on certain medications? Am I required to go for regular checkups? How healthy am I as an individual? You need to assess that. Then, second, you must also assess, where will I be, say, in the next 5-10 years? As we get older, truly, there are health implications as well that arise as we get older. We need to go for more regular checks, you know, where we probably have some hereditary issues around diabetes and things like that. So you begin to think about those things. And then you now start to look at, what exactly do these plans offer? Because everyone has a different plan that covers either individuals, corporates, or, you know, smaller businesses. If you have a small business you want to cover, you know, it's also important to consider age. Younger people will be much more healthy than older people. So based on my age, what am I looking for, So you need to look out for the plan and what exactly it covers. What are the options in that plan? Most people, like you said, look at cost. But honestly, yes, it is something to consider, but there are more important things to consider. If, for instance, I have, eye problems, for instance, I go to the optician, I go to the ophthalmologist quite a lot. So I'm going to be looking at a plan that is able to cover those kind of, benefits. What is the limit on that benefit? I need to be looking at things like that. There are people who truly maybe have some chronic medication needs, for instance, hypertension. So what is the drug limit, or what kind of drugs can I get for my hypertension? How can they be delivered? So those are some of the things to look at. It's also important to look at coverage and provider network. We have over 2,000 hospitals in our provider network today. So we're saying, what hospitals are you comfortable going with? Is your hospital that probably you've used from, a much younger age on that plan? Can I access this hospital? Is this hospital close to my office or close to my home? So those are kind of things to consider in terms of the options, and then begin to look at whether you need a comprehensive plan or just a very basic plan or something that is more customized and tailored to you. So there are a lot of options to look at apart from cost. We live in an environment where cost is...
I think for health insurance, there's a certain age that the health insurance won't give you cover. Because I was talking to this health insurance company, and because we're a group of over 60, and I think the limit is 65. Is that the same with your own? That's my first question. The second one is, when I go to the hospital, which is very rare, I'm happy to say, I don't have health insurance, so I go with my money. And I notice a lot of people with health insurance, they are there for hours. Me that I come with my money, they will just answer me. I leave them, the people that I met there, I leave them there because I have the cash to pay.
To pay, wow.
And these people that are on health insurance, they just keep them sitting there. So how will you assure me that that will not happen to me if I decide?
Okay, so I'll take the first question. Thank you for that. You're right, a lot of HMOs haven't covered people above the age of 60. But we have senior citizens plans which cover from 65 years and above, because we realize that these people too need care, So we have a senior citizens plan suited and tailored for, individuals that are above 65. And what we've seen happen is also we have a lot of young people who typically don't fall ill, do not have dependents. So they want to buy these plans for their elderly parents, uncles or aunties, So we've curated and created something that fits within that age bracket. So we have about 3 plans that address that. And we're always happy to, be able to push that plan for our senior citizens of the country. So we're able to do that. To the second question, you're right. There is a lot of wait time, but what we have done differently most times, what happens really in terms of the wait times is, they're trying to get through to the HMOs to respond or give some approval, correct. But we've been able to use technology to drive a lot of that in terms of service. We've seen it happen in the financial institutions. Why can't you at the click of a button, So we've automated, for instance, the pre-authorization process so that you don't have to stay waiting in the hospital for such long periods of time. So that for us is a differentiator. So there's an automated pre-authorization. One of the things we've also tried to push is change consumer behavior to be able to book appointments via our mobile app. Because when you book appointments, it's easier. You have an appointment booking process. You can go ahead, book that appointment, go to your hospital at the time that the appointment has been slated for, and you're able to see a doctor. It's a straight-through process. We understand that these are gaps, to be honest, in terms of course, that service delivery.
Emergencies.
Yeah.
For emergencies, even the hospitals take emergencies straight through. Yes.
Nigeria hospital.
You're thinking of the old Nigeria.
Yes, it has changed, but an emergency...
Let me ask you. We have to think forward thinkers.
Absolutely.
Let me ask a question concerning, is it accessible for Nigerians across the country, or is it a regional HMO? Because some HMOs are just in certain states. They say, I can't find it I want to do for my mom in Alhambra right now. I can't reach her.
All right, so we're a national HMO, which means we're present in all the 6 geopolitical zones and can operate anywhere in Nigeria.
Okay.
We have over 2,200 hospitals, which means that we're hospitals everywhere from Anambra to Bauchi, anywhere you want to access care, you can access care through Bastion HMO. We realize that truly, even for families, even when you travel out of state, you do need access to care. So we've created a very wide and broad network across. We even have an office today in Maiduguri because we understand that, there are NGOs who are helping the IDP camps there. So we're everywhere, as a national HMO, we're everywhere providing care and access for everyone, every single Nigerian.
So let's talk about affordability for a bit. Because you look very tush right now. You sound tush. Your English is clean. And someone out there is wondering, are you sure I can afford this HMO? And for people in different corporations, sometimes they are in a package that the company has probably bought for them. But then they go to the hospitals when they have certain ailments and they can only get things like paracetamol. And then here your HMO does not cover it and all that. So how affordable is this, your HMO, for the average Nigerian who isn't earning so much?
So thank you. For Bastion, we have several healthcare plans across, across the various spectrums. So we have plans for individuals, we have plans for small and medium scale businesses, we have plans for corporates. We have plans that are as low as 18,000 because we understand that truly healthcare per annum.
Per annum, 18,000 per annum.
Yes, so we understand that healthcare, to be honest, is a fundamental right for everyone. It's not necessarily a privilege. So we, as much as possible, have tailored these plans across various, pockets for everyone to be able to afford what fits them or what is able to, what they, So for some people, truly, the major ailments they do have is probably malaria. So they don't necessarily need maternity, OBGYN. So there's a plan that, is tailored or suited for you. So affordability, honestly, is
Right.
something.
We have to wrap up with you. Let me let you take
Okay, let me just ask the last question because it's just easy to say some affordable, but even does your premium have a cap in terms of unforeseen circumstances where someone might go to hospital for malaria and then get into an induced coma for the next 6 months and stuff? Is there a cap on your premium that's because these are the reasons why people really want insurance, where for unforeseen circumstances, basically,
Yeah, so again, this is why it's important to choose the right plan. When you're choosing a plan, you need to look at those things, limitations, caps, what is the cap in terms of, how many consultations or how many sessions can I go for? If I need physiotherapy, am I going for a plan that has 5 sessions or 10 sessions? So those are the things, critical things to look out for when you are buying a plan and to be able to ask those questions as well. So that it's not when you get there, honestly, your expectations are not met. But one of the things we try to do is also educate people as we're onboarding you to tell you, look, these are the issues. These are probably exclusions. A lot of people don't know that. There's some things that are not covered, extreme sports, for instance, or, cosmetic surgery. So you need to be able to inform them of these things. And even when they're looking out for it, what to look out for is very important.
You don't do cosmetic surgery. What if I want to do cosmetic surgery in my old age?
It's insurance, the plan for insurance is unforeseen, we
have to wrap up with
events
you. I
that
think,
might arise.
is there a number? Is there a flyer, website you can go to?
So we are on all the social media handles, from Facebook to LinkedIn to Instagram. BastionHMO.com is our website. And we can also be reached via phone call 08000 227 8466. Is our number, and you can
You
just
spell Bastion for those who don't understand.
Bastion.
Right.
It actually means fortress.
Yeah.
So we're here to protect you, and ensure that truly you have access to care whenever, wherever.
Thank you very much.
Thank you.
Thank you very much.
That's
Thank you
all
for
we
having
can
me.
take on this segment. When we come back, move on to our hot topic. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.